So since the COVID epidemic started and Covid-19's been around, we've endeavoured and have managed to keep flying and have kept going to patients all the way through. This has created some additional challenges, and so one of the big things is we've got a big screen now up in the aircraft that we can't see in the front and the front can't see in the back, and that creates, believe it or not, its own challenges because it's a very enclosed space. You're very isolated back here, even though you couldn't do a great pilot. It feels more isolated, and it can increase your the way you perceive things. So you haven't got such a good visual reference, which can make you actually feel a little bit more nauseous than you normally would do. Other things are with the PPE. We have level 2 PPE and level 3 PPE, and those different levels will be required depending on which call you're going to, and quite often we don't know which call we're going to, so we often put on the highest level of protection we possibly can, just in case we need it. And that can be a real challenge. That's a case of more or less undressing and redressing, and sometimes that might be done in the aircraft. If you're wearing this underneath your protective equipment, it can be incredibly hot. And then when we actually get to scene, sometimes what we do is we can't land right next door to the scene. We land a little bit away from the scene, and people kindly give us a lift. So the helicopter lands, a car might be flagged down, we get into the car with our equipment, we drive up to the house or wherever it might be, and then we unload our stuff. Well, we can't do that at the moment because we can't cross-contaminate with anybody. So literally, wherever we land, we're having to walk with our equipment and all our protective equipment on to the scene, which is sometimes a long way up hills. And no matter how fit you are, you can arrive on scene feeling quite exhausted. After we finish every job, we have to take all the equipment out of the aircraft. We have to clean the aircraft thoroughly. We have to clean all the equipment thoroughly. We then have to put the equipment back in. So what would be maybe an hour call or an hour and a half call or whatever it might be, now becomes a 2.5 hour, maybe 3 hour call because of the cleaning of the aircraft as well for the next patient. It's a really well thought through process, but the process is quite onerous and does take quite a long time, but is really necessary in these times of COVID.